Good evening, everybody. My name is Miguel Pinero. I'll tell you about a story about a 21-year-old girl who's in college with her friends. Caitlin was a beautiful young girl. She went out every weekend after a long week of school, worked hard in school, but she also played hard, I guess you could say. She always went out and drank on the weekends, stuff like that. So one Saturday night, her and her friends went to karaoke bar, had a few drinks, 5 or 6 to be exact. And no harm done. She went home, went to bed. And that next morning, she woke up with some pain, some abdominal pain. Didn't know exactly what was going on. So, she just thought she was nauseous from drinking. But that night, it was still bothering her. Usually a hangover doesn't last that long. So, she was like, possibly she could be pregnant. So, she went with her and her friends. She went over and bought a couple pregnancy tests, and she took them, and they both were positive. Of course, she freaked out, didn't know how long she'd been pregnant. She was actively with her boyfriend for the last 4 or 5 months, so who knows when it could occur. So she was a little bit scared. So that following Monday, she went and saw her OBGYN, and come to find out, she was 7 weeks pregnant. So the past 6 weeks, every weekend, she's been drinking and going out with her friends faithfully every weekend, and she's had a baby inside of her the whole time. Now, what this could cause in the baby is what's called fetal alcohol syndrome. Now, fetal alcohol syndrome is caused by the pregnant woman consuming alcohol throughout her pregnancy. Now, many infants yearly are born with this medical condition throughout the USA. According to the Center for Disease Control and Prevention, 12.2% of women that are pregnant report use of alcohol sometime throughout the pregnancy. Now, the most vital time is, of course, early in the first trimester is when alcohol can have the most damage on the fetus, because that's when they're reproducing their organs more and everything like that. So, if you really think about it, just think about 8 women you know in your life. One of those women have reported using alcohol. 1 in 8 women report using alcohol throughout their pregnancy. So to understand exactly what fetal alcohol syndrome is, we will talk about what exactly causes it and what some of the symptoms are, what are some of the results, the growth, mental, physical problems that the child could have. So what happens when a woman's pregnant and she consumes alcohol is that the alcohol easily passes through the body to the fetus, straight to the fetus. And also, when you drink alcohol, it's in your blood. So when you're going to transfer it, it's going to get transferred to your baby. So that right there immediately has an effect on the baby from the moment it goes through your body. Now, not every woman that consumes alcohol means that the baby's gonna have deformities or learning disabilities. Not every, but it's a high percentage and it's a risk. So, some of the signs and symptoms are facial abnormalities. So, for example, a kid with FAS they have smaller eye openings compared to a normal child. Also, if you look at their cheekbones, they're flatter compared to a normal child. Another facial abnormality is the philtrum right here under your nose. It's usually curved, but children with fetal alcohol syndrome, it's smooth and their lips are thinner. Also, kids that have fetal alcohol syndrome have learning disabilities. So growing up, from age 1 up as they grow, they have poor language comprehension, and their problem-solving skills are not as good. Also, they have poor memory, and they have the inability to manage stuff such as money and time. Excuse me. Also, So some of the hazards of drinking alcohol while pregnant, of course, is there's always a risk of miscarriage. So of course that's when the baby dies. Also, it could be a stillbirth and a premature delivery. And whenever there's a premature delivery, there's always risk. They're high risk. They're low, and their birth weight is very low. They're real skinny. They need a lot of attention, like as in, medical care, not affection or anything like that. But yeah, they're very high risk. So in conclusion, I hope y'all walk away knowing more about exactly what fetal alcohol syndrome is and what some of the results are of pregnant women today using alcohol while pregnant. Just remember that 1 in 8 women that are pregnant use alcohol. 12.2% of women that are pregnant use alcohol. So if you know anybody that's drinking out and they're pregnant, or you know anybody that has thought about going out while they're pregnant, please, advise them. Take a little bit of what I told you today about some of the signs and symptoms and what could occur in the future. And please inform them, because there's too many kids out there with these disabilities due to something that could be prevented. Thank you. Have a good night.